Have you ever wondered if you're really taking care of your penis? If you are a man, it's over 50 and still think you just need to worry when you feel pain or something is strange below, you may be ignoring silent signs that put your intimate health at risk. Worse, it may be making mistakes that affect not only your urinary health but also your sex life, self-esteem, and even longevity. Careful? From the age of 50, the risks of problems dramatically increase: erectile dysfunction, recurring infections, acquired phimosis, penile cancer, and even urinary complications that could be avoided with simple habits. But almost no one talks about it. Many men ignore penile health out of shame, misinformation, or that old thought of, this is something that is resolved alone. But it is not. And as a urologist, I can say with all authority, neglecting care for your penis can be expensive in health, quality of life, and even dignity in your years of maturity. Have you ever felt itchy, redness, or discomfort and preferred to leave it? Have you noticed difficulty in maintaining erection and thought it was just the stress of everyday life? Have you ever had a strong odor or secretion and just decided to change the soap? These are signs that your body is trying to alert you, and you should not ignore. Men over the age of 50 need to be more attentive than ever to intimate health. The penis, unlike many think, also ages, and this requires quality care, prevention, and information. It's not just about sex, it's about well-being, safety, and confidence in your own body. And before you think, but I'm fine, I never felt anything, I ask you, are you really taking care of the right way? Most men only find that something was wrong when it's too late. Worst of all, many of the problems that arise could be avoided with simple everyday attitudes. Today I will show you the 5 essential care with your penis that every man over 50 needs to adopt immediately. It doesn't matter if you are single, married, sexually active, or not. This is about real health, about maintaining their autonomy, virility, and quality of life for many years. So if you are over 50, pay attention. What I will reveal you here can completely change the way you view your intimate health, and you may help you avoid painful treatments, unnecessary surgeries, or even the embarrassment of facing problems that could have been prevented with a little more care and information. Stay with me until the end, because in the next stretch, I will show you why most men of your age are missing ugly when it comes to penile health. And most importantly, how can you start taking care now, the right way? Before we continue, I want to make a quick but very important invitation. If at some point in your life you have had any questions, worry, or even ashamed to talk about the health of your penis, comments down here. Yes, comment. You are not alone. Thousands of men go through the same questions, and when you comment, in addition to strengthening this community of mature men who want to take care of yourself, you still help YouTube understand that this content is relevant. And look, if this conversation has already made you reflect, if at any time you thought, it fits me, or I need to pay more attention to it, leaves like right now. This simple gesture shows that you value your health and want to see more content like this here on the channel. And of course, you subscribe to the channel and activate the bell. Each week, I bring medical guidelines, practical tips, and serious alerts about man's health after 50. Truth information without winding, without taboo, and without judgment. Only clear knowledge, direct and based on medicine. Best of all, everything is especially focused on you who have gone from middle age and want to grow older with more health, energy, and autonomy. Now, enough to curl, because in the next stretch you will understand exactly where most men are failing when it comes to penile health, and why it can be expensive. Let's go to this. And maybe now you are wondering, but do I really need to worry that much about that? Yes, and I will explain to you why. The truth is that after age 50, your body changes, and with it your penis as well. It's no exaggeration, no drama. It is physiology, it is biology, it is natural aging. But unfortunately, most men just don't talk about it. Worse yet, many completely ignore the signs that the body gives. They believe it is normal to have less desire, that it is normal to take longer to have an erection, which is normal to feel itching, irritation, or pain and do nothing. But this is far from normal. What happens in fact is that over the years the risk of urinary tract infections increases considerably. The urethra can, being more sensitive, the immune system no longer responds in the same way, and penile hygiene, when neglected, turns into a gateway to bacteria and fungi. These infections may not only cause burning and discomfort, but also lead to larger complications that affect your bladder, kidneys, and even your prostate. And many times the starting point is there, in a simple care that was set aside in everyday life. Another critical point is erectile dysfunction. We need to talk about it without taboo. Erectile dysfunction is not just a sexual problem, it is a warning of your body. It is often related to poor blood circulation, diseases such as diabetes, hypertension, high cholesterol, or even chronic stress. And more than that, it is linked to your lifestyle and habits. Yes, even the way you take care of your intimate health. The absence of regular erections can directly affect the oxygenation and health of penile tissues. That is, stopping frequent erections is not just a consequence of age. It can become an aggravating factor for other conditions. And did you know that Brazil is one of the countries with the highest number of penis cancer cases in the world? That's right, a cancer that is avoidable in most cases. And that, even so, still leads thousands of men to the amputation of the penis every year. This happens largely due to poor intimate hygiene and for lack of information. Men who do not properly wash the region, especially if they have phimosis, accumulate secretions such as smegma, which favors the growth of bacteria and viruses, including HPV, one of the great villains of penile health. And here comes the scariest part. Many only seek help when the injury is already in advanced stage, when there is already pain, bleeding, visible wound. And at this point, the treatment options are already much more invasive and impactful. It is no exaggeration to say that taking care of the penis after 50 is an act of responsibility to yourself. It is not vanity. It is preservation. It is survival. It is respect for your body, your history, your sexual health, and your dignity. Because a man who takes care of his intimate health feels safer, more confident, more willing, and this is reflected in all areas of life and relationship, self-esteem, work, general well-being. No old age to take care of yourself, but the sooner you start, the lower the risks you are at. And there is more. What many men do not realize is that penile health is directly linked to their active sex life. Those small changes that seem irrelevant, as it takes time to maintain erection, decreased desire, pain in sex, or even discomfort during masturbation, are signs. Your body is talking to you. And what you do with this information is what defines how you will grow old, with autonomy, energy, and pleasure, or fear, pain, and regret. And you see, I'm not saying you have to become an athlete or an anatomy expert. What I am saying is that simple daily care can completely change your healthcare trajectory. Basic things such as correct hygiene, observation of any change in the skin of the penis, regular frequency of sex or masturbation. Yes, this also tells to maintain the region active and healthy. Use of condoms, periodic trips to the urologist. It is all part of a routine that prevents serious diseases and keeps you active for much longer. Most men over 50 still live with a very dangerous mindset, that if it didn't hurt, it's all right. But you don't have to wait for it. You don't have to expect something to get red, hurt, smell bad, or stop working. Medicine has evolved, and you can also evolve. Taking care of your penis is a fundamental part of a healthy, full, worthy life. And do you want to know what is more common than you think? Men your age who have passed some symptoms, some discomfort, ashamed to go to the doctor, for thinking it's silly, by thinking it will pass alone, for fear of a diagnosis. And because of this, they reached a point where recovery became much more difficult. But it doesn't have to be so. You don't have to repeat this story. You can choose to do differently. Now, think to me, how many times have you heard that taking care of intimate health is freshness? What man has to endure firm, that complaining is a sign of weakness? This kind of thought, besides being outdated, is dangerous, because it prevents you from prioritizing preserving yourself, living with more quality. When you take care, you show that you are ready to live longer and better. And this is strength. This is wisdom. This is maturity. So if you are listening here, it is because deep down you already know that it is time to change this pattern. It's time to look more seriously at your penile health, to understand that small attitudes today can guarantee many years more well-being and satisfaction. And if you got here, I want you to comment below, "I'm ready to take care of me." Write this in the comments now to seal this commitment to yourself. Or if you prefer, comment on your age, and if you already take care of your penis. Your experience can help other men as well. In the next capital, I will reveal you what are the 5 essential precautions that every man over 50 must adopt with his own penis. They are simple attitudes, but they can make all the difference in their intimate life and their overall health. So stay with me, because now is the time to learn and practice what to do to protect yourself, take care, and stay strong and healthy at all stages of life. And now that you have understood why it is so important to take care of intimate health after the age of 50, the most anticipated time has come. I will show you, in detail, the 5 essential care that every mature man must adopt with his own penis. And when I say essential, it's not an exaggeration. They are simple, affordable practices that do not require much time, but make a huge difference in their penile health, self-esteem, and quality of life as a whole. So if you are here so far, pay close attention, because this part of the video can be the watershed between a life with discomfort, insecurity, and risks, and a healthy, safe, and complications-free, intimate life. Let's start with the base of everything, the intimate daily hygiene. It looks obvious, right? But you would be surprised by the amount of men, especially over 50, who think that passing water in the bath is enough, and it is not. Proper cleaning of the penis should be done every day, carefully, without haste, especially if you are not circumcised, that is, if you still have the foreskin, that skin that covers the glands. In this case, it is essential to pull this skin carefully while bathing and wash the entire area with warm water and neutral soap, without perfume. Aggressive, fragrant, or strong antibacterial soaps may irritate the sensitive skin of the penis, change the natural pH, and even favor fungal infections. By the way, speaking of fungi, a very common mistake is not to dry the region well after the bath. Constant humidity, especially when combined with heat and lack of ventilation, is the perfect environment for the proliferation of fungi, such as candidiasis. So, after the bath, dry the penis thoroughly, especially the area of the glands and between the folds, with a clean and soft towel. This minor care can avoid itching, irritation, and even injuries that in many cases are confused with more serious diseases. Another detail that many people ignore is the choice of underwear. Looks like silly? It is not. Synthetic, tight, and not allowing proper ventilation to create a stuffy environment, favoring infections and discomfort. Prefer cotton, light fabric underpants that let the skin breathe, and change them every day. It may seem obvious, but there is a man who, by laziness or carelessness, ends up repeating the underwear the day before, and this is a full plate for unwanted bacteria and odors. The right underwear, used correctly, also helps keep the testicles at a proper temperature, which directly influences sexual health and even hormonal production. Now let's talk about a very important point: safe sex. Just because you have gone over 50, that doesn't mean it's risk-free. Quite the contrary. Unfortunately, many mature men relax in this regard and stop using condoms, believing that STDs only affect the younger ones. But the truth is that diseases such as syphilis, genital herpes, HPV, and even HIV remain a threat at any age. Worse, in older men, the immune system no longer responds with the same force, which can make these infections even more dangerous. Therefore, using condoms is not a sign of distrust or insecurity. It is a sign of responsibility for health itself. Also, it is essential to do periodic tests, even if you are in a stable relationship. Regular STD testing is a form of care for you and who is by your side. Another fundamental care is self-examination. That's right. Just as we speak naturally about the self-examination of the breasts for women, men must also learn to observe their own body. And when it comes to the intimate region, this attention should be redoubled. Take a moment, at least once a week, to visually observe the penis. Look for skin color changes, swelling, wounds, lumps, secretions, or any change you do not recognize as normal. Sometimes the onset of an infection, inflammation, or even a tumor begins with a small, almost imperceptible signal. And the sooner you notice and seek help, the greater the chances of effective, fast, and less invasive treatment. Many men are ashamed or fear of looking at themselves and that attention, but this is a gesture of courage and maturity. It is a sign that you care about your well-being, your virility, and your health in general. Remember, no one will take care of your body for you. This commitment is yours, and it begins with these small gestures of observation and prevention. And of course, care that cannot be missed at any stage of life. let alone after 50, are preventive exams with a urologist. And here I speak as firmly as possible. Do not expect to feel pain to make an appointment. The urologist is the professional who will guide you, evaluate your sexual, urinary, and hormonal health, and ask for exams such as rectal touch, PSA, ultrasound, laboratory tests, and what is most needed, according to your history. Many serious problems, such as penile cancer, prostate cancer, benign prostatic hyperplasia, and even silent infections, are only detected with routine exams. Avoiding the urologist for shame or prejudice is a mistake that is still very expensive for thousands of men every year. This is why the Blue November campaign exists, to remember that taking care of man's health is a necessity and not a taboo. And when you are willing to do this regularly, you show that you are taking control of your life. These 5 care that I showed you here are not complicated. They don't require money, no expensive equipment, no great sacrifices. They only require attention, consistency, and willingness to live well. Because when it comes to penile health, prevention is always the best way. And believe me, the results appear. You feel better, more confident, more willing. Your performance improves. Your self-esteem grows. And you start to live more peacefully knowing that you are doing your part. If you have arrived here in this video, it is because you care about your health. And this is already the first step. Now I want to know about you. Of these 5 care I said, which one you already practice and which one do you know that you need to improve? Write here in the comments, because this space is for this. For us to talk, exchange experiences, and create a support network between men who want to grow old, dignity, and quality of life. And now that you already know what are the indispensable care to keep your penile health up to date, we need to talk about something equally important. But many people prefer to pretend that it does not exist. Errors. Yes, the mistakes that, even being common, are very dangerous. Many of them are committed for lack of information, others for stubbornness, prejudice, and even shame. But the truth is that these behaviors, if not corrected, can seriously compromise their intimate health, especially after the age of 50, when the body no longer responds with the same agility, and the margin of error becomes much more delicate. So he listens carefully what I'm going to tell you now, because maybe you're making one of these mistakes right now, and you haven't realized it yet. One of the most frequent mistakes among older men is completely stopping masturbating. And do you know what is the thought behind it? This is a young thing. I've passed this phase. But this idea, besides being outdated, is a disservice to its own penile health. Masturbation is not just a sexual activity. It is also a way of keeping the penis active, irrigated, oxygenated, and functional. When you masturbate regularly, within your pace, your reality, with balance, you are helping to keep blood vessels in operation, active cavernous fabrics, and even helping to prevent erectile dysfunction. In addition, ejaculatory stimulus has an important physiological function, as it helps eliminate accumulated secretions, reducing the risk of inflammation and infections, including prostate. Another serious mistake is to think that impotence is normal and simply accepting it as part of aging. I understand that over the years the body changes, hormonal production decreases, sexual desire can float, time to reach erection can increase. This is all real, but feeling constant difficulties to have or maintain an erection is not something that must be ignored. It is a clear sign that something is not right. And here we are not just talking about the sexual issue, but also about vascular, emotional, and even metabolic health. Erectile dysfunction may be the first symptom of cardiovascular disease, diabetes, or hormonal disorders. So instead of facing this as a natural age, face it as a warning of your body, something that needs to be investigated, treated, accompanied, and most importantly, something that has a solution. With correct follow-up, habit changes, and, if necessary, proper treatment, it is possible to recover the quality of your sex life. Now let's talk about self-medication, another very common error, and dangerous. Many men, noticing a drop in sexual performance or some rite in the intimate region, run to the pharmacy and buy any medicine indicated by a friend, neighbor, or even the clerk. The problem is that this habit can be a shot in the foot. Using medicines without medical advice can mask important symptoms, delay the diagnosis of serious diseases, cause serious side effects, and, in many cases, lead to a worsening of the picture. And here is a special warning. The indiscriminate use of drugs for erectile dysfunction, such as the famous blue compresses, can cause increased blood pressure, arrhythmias, intense headaches, and even psychological dependence. What should be a possible support, with indication and medical supervision, ends up becoming a dangerous addiction that hides larger problems. It also has the mistake of ignoring obvious signs that the body gives. And here I'm talking about wounds, redness, bad smell, abnormal secretions, persistent itching. All of this is a sign of alert. But many men, out of shame, neglect, or fear, prefer to wait. But what could be resolved with a simple ointment or a hygiene adjustment can turn into a more serious infection, or even something more severe, such as a carcinogenic injury. And then, the treatment is no longer so simple. It already requires more time, more medications, more emotional wear, which was a care of minutes a day becomes a problem of months or even years. So pay attention to your body. He talks to you. Only if you don't listen, he screams. And when you scream, the pain is greater. Finally, I could not fail to mention the biggest mistake of all, avoiding the urologist. This is perhaps the most common among Brazilian men. Whether for fear of touch examination, ashamed to expose something intimate, or pure cultural resistance, many men avoid going to the doctor as much as possible. But the truth is that the urologist is not a bogeyman. He is a trained, prepared, and experienced professional to help you, without judgments. Going to the urologist is an act of maturity, responsibility, self-love. And the sooner you seek help, the simpler the treatment, the more effective the prevention, and the greater your chances of living with quality. Avoid the doctor for fear or taboo, only the inevitable. The sooner you take care, the simpler is the solution. And believe me, almost all the problems I attend to the office could have been resolved much easier if the patient had come before. I have seen men lose their sexual function by negligence. I've seen cases of infection that advanced until they become cancer. I've seen relationships end up being the lack of dialogue and care for intimate health. All this because it lacked courage to take the first step. But you are here now, listening to this message, and it shows that you are already a step ahead. All that remains is to transform this knowledge into action. That's why I want to propose you a challenge. Reflect with sincerity. Which of these mistakes have you made or make it? Have you stopped going to the doctor out of shame? Have you ever used medicine on your own? Have you ignored a strange sign in your body thinking it was going to pass alone? Be honest with yourself. And if you want to share this with me and other men who are also looking for more health, comments down here. You can write like this: I have already made mistakes, but I want to change. Or if you prefer, share which of these points caught your attention today. Your comments help to create an environment of exchange and support between men who, like you, are learning to take better care of yourself. If you got here first, congratulations. Few men have the courage and willingness to listen carefully to this kind of content until the end. This shows that you are really committed to your intimate health, your quality of life, and your virility. Now I want to ask you a simple but very important favor. You subscribe to the channel right now if you haven't done it yet. Here you will find direct content, without winding, with practical guidelines on man's health, especially for those who have gone over the 50th. Activate the bell to receive the next videos, because this is just the beginning of your journey of care and transformation. And if you stayed until the end, comment below. I take care of my intimate health. Write this in the comments for me to know that you are mine, that you value this kind of conversation and are ready to do differently. Oh, and of course, leave your like. This is essential for YouTube to understand that this content deserves to reach more men like you. Your like helps spread quality information and save other lives. And now don't leave. Click on the next video that is appearing here on the screen. In it, I will show you a detail that almost no one tells you, but that can be directly linked to the problems that arise in the prostate and the penis after 50. Go there. I wait for you in the next video.